Hi, my name is Dylan Logman. I'm doing this for my intra-athletic training class for Dr. McLevin, a Marshall University student. So basically what I'll be showing is the ice part of the RICE method. So you do rest, ice, compression, elevation after someone has an injury that has excessive swelling. I'll do the ice part. Basically, going to show the pain control, how ice is a vasoconstrictor. It's going to decrease the swelling in the injured area. And also you're going to have the gait control, which is going to mask the pain nerve, basically, because you're going to have that temperature, pressure, and touch nerve that's going to be sending signals to the brain that will basically mask the other nerves' pain receptors. So what I'm basically going to do is stick my foot in here. I'm going to describe all the senses that I have while I have my foot in here, and then I will just wait till it goes numb, which should take about a minute and a half. So here we go. Okay. So basically what I just feel is kind of sharp, just like nervy pain, because it's really cold. And I just wait for a minute and a half. I'll probably feel different sensations, but besides that, within a minute and a half or 2 minutes, it should just probably go numb. So again, I'm doing this for Dr. McLevin's intra-athletic training class, and representing Marshall University, because that's what he wanted us to do, so go Herd. But as of right now, yeah, the gait control, basically, I'm having one nerve just mask and out signal the other nerve to my brain, so it'll decrease the swelling because your foot should be vasoconstricting. Due to the ice, will decrease the blood flow to the injured area, and then also the gait control again will decrease the pain, hopefully, and that's why we do the RICE, the rest, ice, compression, elevation process after an injured component such as this. And then right now, really, I'm just kind of feeling kind of a pressure pain, I guess. Really, I don't know, not too bad, but I can feel it starting to go numb. But then after that, just ice. But yeah, about this point now, it's just feeling numb. I'm not even feeling really the coldness anymore. So again, to end the video, this is why we use rest, ice, and we use RICE, which rest, ice, compression, elevation, is to decrease that swelling after after you injure an area of your body, such as a rolled ankle or anything. You're gonna get that tissue tear, and the tendons and ligaments and everything will have some type of injury to it, which will cause swelling and stuff. And this is basically just trying to get it out, so you decrease that pain, decrease the swelling, you can get back to action. But thank you.